Breast Cancer Awareness Month is a campaign for education to support women. It's an effort to reduce breast cancer risks, encourage screenings, and the seeking of medical attention if a suspicious lump is detected. And joining us now to talk more about this is Omni Family Health's Dr. Purney. It's good to see you.
Thank you so much for having me.
Yes, of course. So break down what exactly is breast cancer and are there different kinds?
Breast cancer is a type of cancer which starts in the breast. Cancer starts when the cells begin to grow out of control. Breast cancer occurs almost entirely in women, but men can get breast cancer too. There are different types of breast cancer, but the most common ones are ductal carcinoma in situ, lobular carcinoma in situ. There is another most common type of breast cancer, which is invasive carcinoma, where cancer starts either in the ducts or the glands, but it spreads to the surrounding breast tissue. And it can also spread to different parts of the body.
What are the risk factors that people need to be aware of for breast cancer?
As you age, the risk of breast cancer also increases. Having a family history of breast cancer, having first-degree relative like a sister, mother, or daughter increases a patient's risk of having breast cancer by twofold. Having two first-degree relatives puts the same female at risk of having breast cancer by threefold. Having cancer in the breast in the past can also put at risk for having a new cancer in the other breast or in different part of the same breast. The other ones are ethnicity. Caucasian females are more common to get breast cancer than any other woman of different ethnicities.
How is a breast cancer screening done?
Breast cancer is sometimes found after the symptoms appear, but unfortunately in many women, they have no symptoms at all. This is the reason why breast cancer screening is very important. Screening is done through mammograms, which are low-dose X-rays of the breast.
What is the age that people should start getting those screenings?
We recommend breast cancer screening at the age of 40 to be done every year. Breast cancer screening is done as long as the individual is healthy and is expected to live for the next 10 years. These guidelines are for women with average risk, but for women with higher risk, they can start breast cancer screening as early as age 30 with mammograms and breast MRI.
How can someone lower their risk of getting breast cancer?
There is no certain way to reduce the risk of breast cancer, but there are some things that you can do to prevent it. Exercising regularly for at least 30 to 45 minutes a day, getting to and maintaining a healthy weight, getting regular screening mammograms. And some women who breastfeed for longer months have reduced risk and also cut down and limit alcohol intake. The best method is to talk to your physician who would determine your risk of breast cancer and to see if there are any other options to prevent it.
Dr. Purney, thank you for joining us. This is so important, so I really appreciate you coming on and just reminding everyone what to look out for and when to seek medical attention. Thank you so much. And for more information, you can go to Omni Family Health's website, omnifamilyhealth.org.